Welcome to our symposium. So happy to see so many faces here. I'm Tammy, and like Kelsey said, I help run some of the CarePro training here at Honor. And I'd like to introduce to you our guest today. So this is Claire Day. She is a Chief Program Officer at the Alzheimer's Association for the Northern California and Northern Nevada chapters. Do you want to do a quick intro about your time there?
Sure. So thank you so much, and thanks to Honor for having us here today. I've been with the Alzheimer's Association for 16 years, doing different sorts of outreach with program advocacy, education, and research.
Thank you. And Pat Dunn, Mr. Pat Dunn from the American Heart Association, leading the Center for Health and Health Technology and Innovation. And you've been with the American Heart Association for 4 years?
4 years. Yeah.
Great. Do you want to?
My background is in cardiac rehab. I was an exercise physiologist. You never know it, but let me know. A program director and an educator. So I did that for 32 years.
Great. So happy to have both of you guys here. And so, part of Honor's mission is to really kind of make sure that our care pros are taken well care of, and part of that mission is to make sure that they have the right education and training behind what they're doing to help them care for our clients in their homes. And so we have partnered with these two organizations who have basically collaborated with us and given us their best practices to help our care professionals carefully and thoughtfully care for our clients with these types of conditions, and to better have tools in their toolbox so when they go to these clients they can say, I've learned these in training and I know how to appropriately care for these types of behaviors. And so I'd like to open it up to you guys and would love to talk to you both about kind of what your organizations are doing currently and kind of where you guys are going today. And so Pat, I'm not sure if the audience knows, but a total of 11.5% of American adults are diagnosed with some kind of heart disease. And by 2030, it's projected that 43.9% of the US population is projected to have some kind of cardiovascular disease. But that is a huge portion of our population. But I think your organization is doing an amazing job of kind of bringing awareness and support to this community. Can you talk a little bit about the American Heart Association and kind of what you guys are focusing on right now?
Sure, happy to. So I could actually spend all afternoon talking about all of the initiatives that the American Heart Association is involved with. I'll save you from that. But basically, everything that we do is based on what we call our 2020 impact goals. It's kind of a little catchy phrase, but using a baseline of 2010, our goal is by 2020, so we have 2.5 years left, is to reduce mortality from cardiovascular disease and stroke by 20% for all Americans. So that's relevant to what we were talking about, and to improve cardiovascular health in all Americans by 20%. We'd actually never even defined what cardiovascular health is, so we're getting into that. But we're actually now working on our 2030 goals. And so about a year ago this time, our CEO, Nancy Brown, commissioned 4 new centers of excellence. So I work in the Center for Health Technology and Innovation. Everybody always asks what are the other 3. So it's health metrics and evaluation, workplace health and wellness, and the Institute for Precision Medicine. So what we're doing in the Center for Health Technology and Innovation is we're basically reaching out to the tech community. We're not going to become a tech company ourselves, but we want to help the tech world fulfill a basic promise. And that promise is that technology can result in better health. And we believe that that's really a promise that's yet to be fulfilled. There's a lot of opportunities there. So how are we doing that? First is as a convener. So we have the capability of bringing in all of the stakeholders in the health tech ecosystem, from clinicians and scientists to policymakers to the payers to the tech world and the developers, and yes, even the patients. We also want to bring leadership to the tech world, that the science matters. It's not just about shiny new objects, it's that the information coming through these tech systems, whether it be a wearable device, an app, or even an information management system, that the consumers, the patients, are getting good information from a trusted source. We're also trying to bring leadership to the tech world that the evaluation science matters as well. When we talk to tech companies, we ask, so do you have any data on how effective your solution is? And no pun intended, but it really is the Wild West. So we really, we're trying to help them better evaluate how successful those are. And then the final role is really as a catalyst to innovation. So we believe that if we can bring the medical world and the tech world together, and these are worlds that speak different languages, they share different values. If we can bring them together, get them on the same page, then we believe some magic can happen.
Really important stuff. Thank you. And then Claire, with the Alzheimer's Association, amongst our client base alone, roughly 30% receive some kind of memory care or have been affected by some kind of memory condition, predominantly Alzheimer's. And I know your organization does a great deal of kind of these big outreach and education through conferences and symposiums, but I also know that you guys, on a smaller scale, do things like caregiver support groups and the local chapters that are really helpful. Can you tell us kind of what you guys are doing right now and kind of where you're headed?
Sure. Well, we sort of have two approaches to the way we're looking at care and support throughout the nation. First, we are the largest nonprofit funder of Alzheimer's research in the world. We're number 3 behind the NIA and the Chinese government in the world of funding research, because our vision, of course, is to be unemployed and is a world without Alzheimer's disease. And we know that that goal feels like it gets harder and harder to reach with some of the research outcomes. So there's that side of the disease that we feel it's our obligation and duty to tackle. But then there's the other piece, those 5.4 million Americans that if we found that magic cure tomorrow, if we found the answer, it probably wouldn't help them. And we still have to think about how we can provide a good quality of life for those living with the disease and their care partners. So we do that through education. I love that you mentioned education in the beginning, because it really is the foundation of how we provide good care, not just to family caregivers, but to our professional caregivers in the community. We want to support caregivers and people living with Alzheimer's disease, so we do that through a number of programs like support groups, care consultations, and our 24-hour helpline, which is available for families to call, for people living with the disease to call, for clinicians to call if they have questions. And so we really want to be that local support in the community. So whether you're from the Northern California, Northern Nevada chapter or anywhere else in the country, there are chapters in the local community that are providing these similar programs nationwide. And so our goal is really to make sure that we're arming families and constituents with the best information and support. We all know this disease is 24 hours a day, 7 days a week, and really can't be done alone for very long. And that's why collaborations are so key. And then I really should mention also the advocacy piece. I think we just heard a lot of why we need to get involved with aging and advocacy, and certainly around these issues. That's making sure that we're having implementing change for people is important as well.
Yeah, I love that you mentioned your hotline. We actually show that number within our training. And I always joke, I'm like, don't do this while you're with your client. Prepare yourself and call the hotline prior to or post appointment. So our care professionals get a crack out of that. Anyway, so wonderful that you guys are here. And as we mentioned earlier, we've licensed basically your best practices and have integrated into our training so that they can deliver this kind of specialized care for our clients and with these conditions. Can you guys both tell us why the American Heart Association and the Alzheimer's Association have chosen to partner with Honor in home care and in this caregiving space?
Sure. Well, I think for us it's about collaboration and the sense of community. No one can do this by themselves. There's not one agency out there that's going to solve the needs of each particular disease or condition. And so for us, it's about making sure that we're collaborating with the right people to provide the best care possible in the community. And when it comes to education, it's something that we truly know has an impact on quality of life, right? So if you understand how the brain works and how it doesn't work when you have Alzheimer's disease, it can change the way you approach someone with the disease, communicate with someone with the disease, and therefore provide better hands-on care in the home. And so we also know that as much as people would love to remain independent their whole lives, this disease does not allow for that. And people are going to want to stay in their homes as long as possible, and we want to make sure that we're working with people in the community that share that vision of good quality care in an environment that's conducive to their best outcome.
Thank you. Pat?
Yeah, and for us, with our new center, I get multiple calls every day from, especially from startups, but big and small tech companies that want to partner or collaborate or work with us. And of course, we can't work with them all. So we have to be very selective in how we go about that. So we actually do a fair amount of due diligence on our end, just trying to learn more about who you are, who Honor is. Obviously, it has to be mission aligned. You can't do any of the naughty things like tobacco or things that are unhealthy. But it has to be an innovative solution. It has to be a promising solution, an innovative solution. Also, Kelsey thinks I screen her calls because actually I teach. In my spare time, I teach statistics. So I made a huge mistake early on. I gave out my phone number to some of my students. My students are all online, so the students are all over the place. So now I only answer the phone if I know who it is. So Kelsey learned to text me or to email me. But the bottom line is persistence pays off in working with us as well. But we actually have a very small group of we don't call them partners. There are innovators or our collaborators, but you are in that very small group of companies that we've chosen to work with.
That's awesome. Thank you. And so what kind of benefits do you see from our partnership specifically? So I can tell you that when Katie and I are in training classes, and we start talking about symptoms like sundowning, or we talk about things that happen with people with stroke, we see like tons of hands go up in the air and people wanting to share their stories, and having this kind of content really livens up our care professionals, and they're really interesting conversations that ignite from the types of things that we talk about around both partnerships. And so what kind of benefits do you guys see out of this particular partnership?
Yeah, so first of all, I think that it's really important for us to know that we can be a support to your care pros, right? So to know that we have that, we can provide that expertise and that availability to them to either enhance the way they learn or post that when they're in the real world and they come across a situation, and the challenging behaviors of this disease are very, very overwhelming for a professional caregiver. And so ensuring that they have resources and tools is certainly something that's very important to us out of the relationship. I also think it's important that we really are feeling that sense of community throughout the area, because this is, I mentioned this before, but it bears repeating that collaboration is how we get things done now. We used to work in these worlds of silos where we all thought we could solve the world's problems, and the reality is it takes all of us working together to find those solutions and to find the best practices. And I think for us also knowing there's so many people that come up to me and say, oh, I wish I'd known about your organization when my mom was living. Knowing that you're able to potentially also share that helpline, get the word out to families in the community, just so that we can find the right connection and the help for people when they really need it.
And for us, it's about dissemination and delivery of our content outside of the traditional healthcare setting. You know, the world is changing. You know, just relying strictly on the information coming from your doctor, you know, just is no longer the world we live in. You know, many of the patients that you interact with represent really the best and the worst of our healthcare system. I mean, if any one of us started having chest pain and started having a heart attack right now, I don't know anything about the medical system in Concord, but I would guess that within the hour, we would be in a cath lab, and we would be receiving life-saving drugs by incredibly talented professionals. I mean, it really is a life-saving experience. And if that heart attack was an uncomplicated case, this is Friday, probably Saturday evening or sometimes Sunday, you're probably going to be discharged. You're going to go home, and it's like, oh my God, you know, I almost died, now what do I do? And that's also true for a patient that's been in the ICU for 2 weeks. You know, and they've got a list of mile long of medications. They've got, you know, and so it's very difficult for them to know, you know, what should I focus on? What's important? What should I ignore? What's, you know, where should I be focused? So we started developing care plans around post-acute conditions. So, you know, the typical heart failure, heart attack, stroke. We've gradually been moving upstream into hypertension, cholesterol, diabetes. But these are ways to help the patients on the, you know, we talk about our healthcare system. One of the solutions, it wouldn't solve it all, but if we could get the patients more actively engaged in their own health, that would make it a lot easier on our medical system and a lot easier on our, you know, even the cost burden if we could get patients more engaged. So it's a way to deliver that content, whether it's through video, through print, through social media, different ways to get that information out. So that's for us.
I think for Honor, we see this kind of instantaneous benefit of just like the learning and the utilizing of these best practices. A couple weeks ago when we were in training, we were just getting over, you know, our partnership content, and we had just gotten a new client who had symptoms of dementia, Alzheimer's. And we, you know, selected somebody who matched his credential or his needs with somebody who was actually in training. And we sent her to care for this gentleman, and shortly thereafter I made a quick phone call to her, and she said, "You'd be so proud of me. I literally just used some of the stuff we talked about in class today." And so we see this like quick turnaround of, you know, using that information, grasping that information, and, you know, practicing it right away. So it's been really helpful. And so what does your both organizations kind of hold in the future for both you guys?
Go ahead.
So it's interesting that you asked that, because unfortunately I had to take that call at lunchtime, and it was all about our next strategic plan. So I'm well versed on that this afternoon. Well, you know, I think what we're looking for, first of all, is we know we need to move the research needle, and so there's that whole arm of the organization. We are doing that more in the last 3 to 5 years with increasing funding. Kevin mentioned about calling your legislators, and it truly does work. It truly does have impact, and it's how we now have finally over $1 billion in Alzheimer's research funded through the NIH. In 2011, we had about $463 million. So since 2011, we've more than doubled that money, and that's through advocacy work. So we know that that's still not a lot. You mentioned in the beginning about your 2020 vision. So the Alzheimer's Association's by 2025, we want to have an effective treatment. We used to say cure, but we know we're farther away now. But what we're also learning is how important early detection is. And so we're really starting to focus on that whole piece of engaging with clinicians and healthcare providers about how we're seeing some research coming out that's indicating in the early stages, and we have no data to back this up yet, though, that, you know, we've all learned in the last few years that symptoms of the disease are present anywhere from 10 to 20 years prior to, the plaque is building in our brain 20 years prior to a symptom being exhibited. So in the past, our targets have always hit people that have been diagnosed with the disease, have shown cognitive impairment, and they failed. So what we're looking at now is how, if we're approaching that pre-symptomatic, which is those boomers that we talked about, the people that are cognitively intact but may have that buildup of amyloid plaque in their brain, there may be treatments that are currently being studied right now that have some positive impact on that. And so we've got to change the way we diagnose this disease. We've got to educate physicians, we've got to educate families on the warning signs, and making sure that it's not a crisis that's getting us to the physician or the hospital, and it's a true indication of the warning signs so that we can get a proper diagnosis. So we're really starting to look at how we can change that healthcare spectrum for how we treat and diagnose Alzheimer's disease, and then really looking at bigger partnerships and collaborations. We love to think that we could do it all ourselves, but I always use the example I worked at a previous chapter before coming to California, and we used to get the award for the most amount of helpline calls in a year, which sounds awesome, right? We took about 12,000 calls in a year, which also sounds awesome. We were in a community that averaged about 300,000 people living with the disease. So when you do that math, 12,000 helpline calls really isn't even scratching the surface of who we need to serve. And so we need to be doing a better job. And so our future revolves around looking at those collaborations, looking at those partnerships, and how we can affect that change.
And Pat, I know you talked a little bit about the 2020 plan and 2030 plan, but can you elaborate a little bit on that, and then maybe some things on your research?
Sure. Yeah, in the 2020 plan, a lot of it was increasing awareness of high blood pressure, stroke, signs and symptoms of heart attacks and stroke. A lot of work right now on atrial fibrillation. Also, a lot of work on getting outside of the traditional healthcare setting, getting into the community, working with YMCAs, faith-based organizations, work sites, as also a way to deliver and engage. In the 2030, we're just starting that process, but we already know that the technology and innovation is going to be a big player in that. What will that look like? One of the big challenges is, how do you even evaluate it? So the American Heart Association is a science-based organization. The science rules really everything that we do. And so how do you evaluate the effectiveness of a wearable or a device or a platform? And if you go back to traditional models, like a randomized clinical trial using a drug, well, that drug is the drug. You can control for the drug. It remains that drug throughout all of the different phases. You can do your statistics, and you either have a positive outcome or not. Well, think about the technology. Think about if we had started doing, the iPhone is like just slightly over 10 years old. So if we started doing an RCT on the iPhone 1, those results would just kind of now be coming out, and of course, what would the reaction be? Well, that's the iPhone 1, we're on, iPhone 7, so that's not meaningful to us. So we need to have better ways to evaluate, still using the highest possible level of scientific rigor. But how do you evaluate something, a variable that is constantly changing and constantly, hopefully improving? Well, the good news is you can do it, but that is also part of our plan, is to get a better sense for what is working. It's not, like I mentioned earlier, it's not just about shiny new objects or the hottest thing on the market, but what is actually moving the needle on health outcomes.
Great.
And Tamara, forgive me for not mentioning this earlier, but I also think when we talk about reducing risks, it's really cool that I'm sitting next to you, because when we think about all the things that we can do to reduce the risks for Alzheimer's disease, there are also all the things that we do to reduce the risks for heart disease, right? So what's good for the heart is good for the brain, right? 25% of our blood from every heartbeat goes to our brain. So when we talk about prevention or risk reduction, it's diet, exercise, watching your numbers, cholesterol, diabetes, all those things.
Yeah, and the American Heart Association is also the American Stroke Association, so we're very into brain health. So that applies not just to stroke prevention, but brain health across the board. Whether it's from traumatic brain injury to strokes to Alzheimer's. So there's a lot of work there, a lot of potential overlap. And obviously, people who have these chronic conditions like Alzheimer's disease and heart failure and stroke, they don't just have that disease. That's a challenge and an opportunity for your care pros is it's likely that they have many of these things, Alzheimer's and hypertension, and they had a heart attack, and they have diabetes. And the challenge, and that's even with our care planning, we're actually into version 8 of these care plans. Every time we update them, they become more patient-centric, but they also are more holistic, as opposed to, okay, this is heart failure, but we're going to ignore everything else. That doesn't really help anybody. So we have to figure out a way to integrate and pull from all of these comorbid conditions into a much more individualized, personalized, interactive plan that the patient actually is engaged in, and not just a passive participant in.
Yeah. Interesting that you say that, because when we were teaching kind of these best practices, a lot of our care professionals mentioned, I could be using this, I use these best practices for, these different types of conditions and different types of behaviors that they see and, outside of just memory care and heart care.
Well, when you think about stroke, too, you're talking about someone who has Alzheimer's disease who could be at risk for having strokes. Now you're talking about they have Alzheimer's disease and potentially vascular dementia. Just because you have Alzheimer's disease doesn't mean you're not going to get another type of dementia.
Right.
I know it seems unfair, right?
Yeah. Should be a limit.
So I'd love to ask you guys, is there a memorable story that you could share, maybe based in home care or, teaching kind of your best practices or tips and tricks that you have experienced, either out there or in your personal lives?
And, for me, yeah. For me, my background in cardiac rehab, you're really, you're kind of at the forefront. And I kind of, we kind of get to see in cardiac rehab, get to see the results of all the great work that was done in the hospital. And it's like the results of all that these people are, living well and, they've really gone back to, in many cases, a normal life. You see a lot of tragic cases where somebody was afflicted with a crippling illness very early, but it's also incredibly empowering to see a person who they walk into the rehab center the first time and they're like, I can't believe there's no way I can do this, and 12 weeks later they're walking or sometimes jogging on a treadmill, and that's pretty cool.
So I think my most memorable non-home care related story, because I really do want to share this and the importance of why we all need to work together, was a phone call that I took of a family caregiver who was living at home with her mom and got to that point where she couldn't take it anymore. And so she called us and said that she was going to kill her mother and then kill herself. We were able to keep her on the phone until we could get someone at the home. And I mentioned that one also because you think about support, and clearly she wasn't getting any other support. There was no home care. There was nothing that was providing her that support. But I think related to home care, it's, for me, I think about the Care Pro employees or positions that I've gotten the chance to work with over the years, whether at Honor or with other organizations, is that feeling of satisfaction they had. And Seth, I think you mentioned this earlier this morning when you talked about empowering your staff and that they are the most under appreciated team, I think, in healthcare, and seeing how teaching them something changed their daily approach, which actually fulfilled them in their daily life, in their work life, and gave them something to be proud about and tell people how they made this change.
Yeah, just to add to that, I think, for something like a care pro, their clinical skills and clinical judgment is, I think, far less important than their social skills, their ability to communicate, their ability to engage and motivate that patient to even make just really small steps. You don't have to learn that in medical school. I mean, that's kind of, life 101, but it's a really important part of that. And frankly, being able to learn how to teach. I mean, a lot of people that are educators have very little training in actual teaching methods. And you don't have to go and become a teacher, but you should be thinking about, how am I delivering this information in a way that, this person can actually succeed, as opposed to, well, this person's probably not very smart, they probably would never do anything that I would do, and then just don't even give them the opportunity. You'd be surprised how well some of those people that you didn't think would do well actually do.
Yeah, I think you hit the nail on the head on that one. At Honor, we have this rigorous recruiting process and onboarding process, because we're not only looking for, the skills, but they also have to be in a home with this person and have this type of, intimate relationship and provide companionship care. So, that's a bigger portion of being a care professional, is to be able to provide that emotional support for our clients.
In an environment where most people don't want you there, right? That's the other piece of it. People don't want you coming into their homes, and you have to get through that barrier as well and be supported.
Yeah. Thank you both. I would love to open it up to the crowd to ask any questions for Claire and Pat.
This is actually a question more for Honor, but thank you guys for all of the information you provided and the training that you are giving to the care professionals. I'm curious, is Honor providing that also to families and the caregivers that are within the home? It seems like it would be a great platform to be able to educate the caregivers outside of the care professionals, not only for the knowledge, but even the potential for support to meet other families and people that might be in the same boat.
Yeah, so we've developed, and I think Kelsey can talk a little bit about this, care plans for specific conditions, where we, hand over some of the best practices on the family side as well, to give them tips and tricks and resources that they can utilize within home care and even outside of home care, caregiver support groups. And our assessors are equipped with that type of kind of resources that they can help them get help just, outside the home as well.
Or like a class that the families can come to at Honor, that they would be learning the same training that you're giving to the kids outside of just the resources that are provided.
I think that's wonderful. Joanne?
I'm curious a little bit, Patrick, on your thoughts on wearables and like the new continuous glucose monitoring, fall detection in PERS, and the other one that comes to mind is the like Fitbits and the Apple Watch and their ability to track activity and that type of thing, so biofeedback.
Absolutely. Yeah, I mean, they hold a lot of promise, even the wearables, and you can say, well, how accurate are they? Well, they're still way more accurate than self-report. Okay, so just asking the people, you think some of these people are marathon runners. So, do they get the caloric expenditure exactly right? Probably not. But there's still a really good indication in the case of like an activity tracker. We work a lot with blood pressure monitors. There's no reason why you should only have your blood pressure measured in the clinic, taken at home. And you can still see trends with that. With glucose monitoring, my younger son has type 1 diabetes. I mean, he kind of has to have that feedback. So the feedback, and again, it's really less for the professional and more for the patient themselves, so they can see, oh yeah, I've been a little bit less active this week, or hey, my blood pressure seems to be trending up. What's going on?
I was just going to ask, for each of your organizations, what is
and when I say this, some of you in the room probably might start throwing stuff at me, but some of the artificial intelligence, some of the virtual reality, some of the medical chatbot stuff, where it's literally the computer, engaging, with that patient. But some of the stuff that they can do is pretty amazing. Using things like Alexa, the Google Home, and some of those other AI systems. Just think of the enormous potential. If we had enough doctors and nurses, we probably wouldn't need all that, but clearly we don't. And so we need more resources. So there's a lot of adjunctive, technology that shows promise. None of them have completely answered all of the tough questions, but they hold a lot of promise.
I think prevention for Alzheimer's is a hard thing to talk about right now because we're just not quite there. But I do think when we talk about innovation, thinking about the way we're, to your point also, Pat, about using technology to keep people safer at home longer, is sort of a really innovative way that we may not be changing the trajectory of the disease, but we're changing their quality of life on their lifespan, which is really at this point just as important. Although, obviously this is an exciting time in Alzheimer's research when we think about risk reductions and prevention, but we're not quite there yet.
Yes, from the Alzheimer's Association, are you doing anything to educate the general public about all of the people that are out in the population who are early stage Alzheimer's? And we hear things like the police shot a man because he didn't understand their command. And my experience with my mom when she was old is that very visible. People out in the world don't respect and honor that you're walking maybe with a fragile elder who may not be aware. Are you doing anything about public awareness?
Yeah, so increasing concern and awareness is a major strategic objective of ours. We do try to work with local law enforcement agencies as much as we possibly can with the general public on increasing awareness. For that very reason, we try to educate them about approach. It's sometimes with someone with dementia, it's all about how you approach them, which side you even come from, which can change the outcome of the interaction. But we also, I think, need to rely on each other to do that as well, right? So the Alzheimer's Association has one voice of many that needs to be talking about the importance of understanding that Alzheimer's disease is not a part of normal aging. As we age, it's not normal for us to not be able to distinguish the difference between a fork and a comb, and that it's not the stigma, right? The mental capacity stigma. We need to bash those barriers down. So we're trying, but we've got a lot of work to do. We need a lot of voices to help us.
Thank you.
And we have time for one more question.
Yeah, this is for Patrick. Kind of going with your comment about randomized clinical trials and standing up kind of wall on data. What are the data analysis models of evaluating data have seen the healthcare community kind of demonstrate to that may have potential to replace be an acceptable alternative to randomized clinical trials?
Yeah, so we have a health tech advisory group, and these are literally the best and the brightest researchers in the country. And we're developing a research agenda designed specifically for health tech. They're much, instead of a kind of a 7 to 10 year cycle for an RCT, these are very rapid cycle. And just quickly, phase 1 is, does it work? Will people use it? What are the gaps? The second phase is really a quality improvement methodology. How do we then go from point A to point B? And then the third phase is really using cycles of learning. So that's where the technology and the innovation can continue to advance, but you basically reset and you have basically mini RCTs throughout the course of the trial. But at the end of the trial, you still have the most advanced technology and the best scientific rigor.
Thank you. Pat, Claire, thank you so much for your time today. We're so honored to be partnered with you guys and excited to see what's beyond our future. Thank you.